It is an innovation that provides services to young people, and it's a digital platform that sits on Facebook. So it's literally a health system that sits on Facebook as a Facebook page. Okay? So how it works is this. An average young person between the age of 16 and 28 can go to the page and inbox the page and say, I would like to I want a morning after pill. And they'll be able to book an appointment with a doctor and go and pick up that morning after pill for free. That's how YouthWise works. So, like I said in the beginning, the innovation was born in Botswana, and it was called TeenWise. The reason why it was called TeenWise because we wanted it to appeal to teenagers. When they tried it in Botswana for the first 2 years, they managed to reach out to more than 5,000 young people. So young people are able to inbox the page. There's what we call Access Tuesday. We have picked one day in a week where we get a mobile clinic and we take it at a central location. And throughout the week, before Tuesday, throughout the week, young people are able to inbox the page and book for appointments. So we have a wide range of services that YouthWise offers. We have free modern contraception where you have the morning after pills and all other emergency contraceptives that you know. We have family planning pills. We have free HIV testing and counseling, male circumcision, and for a certain age group, we have free cervical cancer screening. We also have pregnancy testing, STI screening. The service list is long. It's not just also a page that provides you with the service. You can also learn from the page. When you go to the page and you scroll, you're going to find a lot of informative posts. There's a lot of informative content. Right now, we're trying to, in the past weeks, we were posting a lot about the 16 days of activism against gender-based violence, and so we made a lot of cards. So it's not just something that you book services with, it's something you learn from, okay? I heard people talking about technical information. This page, I promise you, you won't see anything technical on it. It answers questions that you didn't think about, like, can I get HIV from touching menstrual blood? Things like that, things you never even thought about. Where to report my boyfriend if he slaps me. We give you that information. So it's your friendly companion when you don't know where to get information. So when it comes to the technicality of it all, we are working, all SAT countries, like I mentioned, SAT is working in different countries. All SAT countries are working with IPPF partners. IPPF is a global Planned Parenthood federation that has global partners. So in Zambia here, there's the Planned Parenthood Association of Zambia, PPAZ. So in Zambia, we're working with the PPAZ to make this a reality. So like I said, that doctor that you're booking an appointment is a doctor that works with the Planned Parenthood Association. So for those of you that are coming from Lusaka, the PPAZ has an SRHR clinic that is opposite the Evelyn Horn College. That is one of our access centers for now. So on a typical access day Tuesday, when you walk into the clinic as a young person that booked the service, when you walk into the clinic, you're going to find some of my colleagues that have come with from SAT that are Youth Hub facilitators that are equipped with knowledge around sexual reproductive health and rights that are going to educate you on not just the information that you're seeking that day or the service, but they will tell you even more. So we've also partnered with young people from the Youth Action Movement that is under the Planned Parenthood Association of Zambia to make sure that when young people book for services and they come that day, they counsel them about the service they're about to access and other services that they would want to access in future. So on a typical access day, when a young person walks in, they're going to be received by that peer educator or that facilitator that is on duty that day, and they'll be welcomed. You're going to find a clinical officer, you're going to find 2 nurses, you are going to find a lab technician, and you're going to find a doctor. So these people, their job is to make sure that they provide you with not just the service, but a youth-first, youth-friendly, and good service. One of the biggest weaknesses, and what weaknesses why YouthWise was born, was because we realized that there's an inequality in the demand and supply. As civil society organizations, as peer educators working in the community, we are very good at going in the community and making noise. Can you come and get the service at the clinic? Imagine if I tell all of you that you can come and get services, or you can come and eat lunch for free at Sibu's house. Is there a lunch at Sibu's house? Yes, but is there enough lunch for everyone is the question. And it's the same thing when it comes to service provision in Zambia. You can create demand for 300 people and the hospital only has 2 condoms. And that is the reality. So Youthwise is there to complement government's effort in making sure that we try to balance the demand and the supply. And in balancing the demand and the supply, we want to do it in a way that young people can, when they access the service, they can keep coming back. Because that is also something that is also a huge gap. Young people don't want to come back when they access a service. So we want to make sure that they're getting the service from their home. They book an appointment. The only time they have to leave their house is when they're actually going to get the service. The page is connected to what is called a chatbot. It's a robot. There's no one that's sitting at 03 waiting for them to text the page. It's a robot. When you text it, it will give you an automatic reply. When you text hi, it will ask you, what is your name? You text it your name to ask you, where do you live? When you text it, that say, well, how can we help you? It's going to give you a list of services that are available. And so when you do all that, it's going to remind you if your access day is on Tuesday, it will remind you on a Monday. Facebook, this page will send you a message in your Facebook inbox. Bah! You have an appointment tomorrow at 16 hours with a doctor to pick up your free morning after pill or to get your HIV test. After you access the service, it's going to send you a message after 1 week. How is it going? And then you're able to explain if you're having any side effects. The good part is that even though you're dealing with a Facebook page, when it comes to accessing the actual service, you're dealing with actual young people, actual service providers that care about how you feel. So even when you book a service, you can change your mind on the very day and you have no hard feelings. Even when you're having side effects, you are able to come back and have it removed. Or if you are seeking a contraceptive. So that's about Youthwise. In Zambia, our plan is to make sure that we reach out to many young people, as many young people as possible. And we are just building momentum on Facebook. We haven't yet started rolling out the services, but we're hoping that we can increase the numbers on Facebook. Even in Botswana, when they started running it first, they had to make it popular. Because in Zambia, people don't buy what they don't know. Okay? So we're still trying to make sure that we gain as much traction as possible. And we're hoping that we can introduce an offline booking system because we understand that the population in Botswana is only 2 million. That is the population of Lusaka. So if we want to reach many people, we need a system that is more than just on Facebook. So we're hoping we can launch a USSD code that young people can text to and still book services offline so that they can come and see a doctor. So the difference between using Youthwise and going to a youth-friendly space is that this one, you book from home. You don't have to call a cousin who knows a cousin that is found at the youth-friendly space that can give you a condom. You are guaranteed of getting a free service that is non-judgmental, that is youth-friendly, and you are guaranteed of an excellent service. So that is Youthwise in general. We are rolling it out not just in Zambia, there's also Youthwise Malawi. That's why when you search on Facebook, this page that I'm showing you is the mother of all pages. This was the first Youthwise. By the way, I forgot to mention this, that only young people between the ages of 16 and 28 can book for the services. So if you are 15 years old, you need consent, written consent, and signed by your mother, or you need to come with her or your legal guardian. The reason why is because even though we want to be as progressive as we want, we still must work within the confines of the laws. Because our job as civil society is not to reinvent the wheel, but to complement government's efforts. So if you're 16 years old and you want a service, you're free to come. Originally, we wanted to work with young people up to the age of 24 because we know that that is where the definition of a young person cuts off in civil society programming. But we're going up to 28 because we believe that you're still in that age group. And also we know that some 28-year-olds, their partners could be younger than them. So we know that that service of providing is not just good for you, but it's also good for your partners. The last thing is that once we start rolling out this service, it is only going to be based in Lusaka, but you are free to spread the word from all over the countries because rest assured will come to your town eventually. But for now, when we start doing the services, we're only going to be in Lusaka. So we're doing it in Malawi, Zimbabwe, Zambia, we're doing it in South Africa, and we're doing it in Botswana. Namibia just started, and Tanzania also just started. We're going to be doing outreaches so that we get the service a lot popular. We'll be doing it in universities, we'll be doing it in communities. So if you're within Lusaka, we'll come near you to popularize the service. So I hope that you've heard something new, and I will take your questions now. You can clap for me.
Thank you so much. Anyone with a question? If you have lost your phone, please see me.
Hi, good afternoon.
Good afternoon, how are you?
Good, thank you. My name is Mwangala. I am from an organization called Pepeta Zambia. And what I have is more of a concern than a question. You were speaking about providing morning after pills, and those have been known to have very terrible side effects for anybody that uses them regularly. So, taking into account people that have had accidents, like the condom breaks, or you have been sexually assaulted, how are you regulating, I guess, access for people that are for young people that are just having unprotected sex and want to access the morning after pills? Are you promoting them as a contraception, or how are you doing that?
Thank you. It's a good question, and I guess the question has questions. So I'll try as much as possible to answer the concerns one by one. The first one is the fact that, first, I do understand right now we sort of have a crisis as to how many young people are abusing emergency contraceptives. Some people don't even know that you shouldn't take the morning after pill more than twice, even in a year or so, you know? So one thing we need to understand is that unlike in youth-friendly spaces, some youth-friendly spaces where peer educators provide the service, when it comes to youth-wise, it is a qualified medical practitioner that will provide the service. So this person knows about what you're about to access, A to Z. So you're not going to get half a page of what you need to know. You're going to get the picture of what you're about to do. So if you and you know, if you've dealt with a medical practitioner, they're going to ask you whether or not you've accessed the service and whether or not you've been abusing the pill. So if you've been abusing the morning after pill and you're having a lot of unprotected sex, obviously the alternative is to put you on a long-term family planning method. So it won't be something that will say, okay, based on what you've been doing, here's some more. And then the other question is whether or not we'll be encouraging, was that your question, whether or not we'll be encouraging different? Yes. So it's only, the morning after pill is only a small part of the family, I mean, the family of contraception, yeah? So there are a lot of other modern contraceptives that would want to make popular with young people. And we will not undersell any product and oversell. Yes, so it's about preference. The information will be provided and is being provided on the page. It's about preference, and we'll be more than happy, more than glad to provide you with the service based on what you want. Yes, so there's no project that we're popularizing more than the other.
Thank you. Any other question?
Hi, my name is Chimpinde, Western Province. I wanted to find out, seeing as you're offering morning after pill, or it's one of the services that are being offered, is PrEP also included? Looking at the fact that people are coming in for morning after pill, which means they're already engaging in risky behavior. So I'm just wondering if that's also part of the package that's being offered.
For those of you that work in this sector, you understand that not, even as it stands, there aren't a lot of service providers providing PEP and PrEP. It's still something that we are trying to familiarize ourselves with, but we're working with a clinic, and a well-established clinic. So if it so happens that we are able to provide that kind of service, we will. The other face, and many of us don't really like think of, sometimes when we say, sometimes the reason why the service is not available in a lot of clinics is because it's expensive. For example, there aren't a lot of places where you can get a cervical cancer screening for free. That's because some of these tests are expensive. So we're just a civil society organization, so it's not the whole package that we'll be able to provide. And I know that PrEP, as it stands, is not in that family. So we'll try as much as possible to encourage the young person to practice safe sex even when they're engaging. But as and when we're able to provide PEP and PrEP, you'll be the first one to know.
Thank you so much. Do I have the last question? These are the last two questions.
Okay, my name is Naomi from Southern Province. I've got a question. You said you offer services to adolescents who are 16 to 24 or to 28, and then 15 they have to get consent from the parent. Now, what about in a situation where an adolescent is staying with a parent who is not supportive of such things? How do you handle it? Do you let them go just like that? Because we know that from 10 to 15, they are also sexually active. So now how do you deal with a case like that?
Yes. So what I do know is that before a person can ask you for a service, there's always an interaction that occurs. Okay. And one thing we do know is we didn't just sit and think, let's start from 16. We know what you know about young people that are sexually active. We know that there are evolving capacities when it comes to young people. Even somebody who's 10 years old may know more about sex than me. But according to the law, that person does not know anything about sex. So even when I'm trying to be a service provider, I must have that in mind. So I'll try as much as possible to counsel this young person that is below the age of consent. And I'll try, in that counseling, I'll try and make sure as much as possible. I find out a lot more information about them and where they're coming from. So that by the time the conversation is ending, we'll come to an agreement one way or another of us getting consent from somebody that is taking care of them. So there's no point where a service provider should break and say, what the hell, they're 11, they need the condom, let me give them. Yes. I think that we always must stick to the health regulations to make sure that first you counsel that person thoroughly and make sure that you get their background information so you can follow up if they do need the service, especially when it comes to issues like early pregnancy. If that child is pregnant and they want an abortion and they're only 12 years old, you must make sure that you get more information so you see how you find how to help them. Yeah.
The last question.
Okay, so with me, it's not a question, but it's more like a recommendation.
Okay.
So my name is Alfred Star, and I'm from Kabwe, then the provincial youth ambassador for the National HIV and AIDS Council of Zambia. So I appreciate the effort you are using to do with media. So my recommendation is not everyone is able to access Facebook information. So I would recommend you as an organization to try to engage even other media platforms such as the radio stations, local radio stations, and the TV stations. So at the end of the day, you are able to disseminate information, because everyone is, the majority of young people, they do listen to radio. Yeah, so that is my recommendation for you.
We have been on radio, actually. We work very closely with ZNBC Radio 2 and 4 and many radio stations and TV stations within Lusaka, such as DC Talk Radio, Capital FM, Hot FM, Millennium Radio, Pan African Radio, Metro FM, Movie TV, and Diamond TV. So we are on TV, on radio, on the regular, to make sure that young people get information about Youthwise. Oh, and QFM with Tikambi.
Okay. I know there are some questions. I saw another hand. So what we'll do, let's go into the next session. Then we'll have Java is still here. So he's going to he's going to answer more questions later on. Thank you so much. We can do much better than that. Totenko naimwe. Thank you. Thank you so much. Next, we have another young person who's going to also give us or open our eyes and tell us what they're doing as young people, all the way from one of the provinces of Zambia. He looks like me, he's tall like me, eh? He's taller than me. Oh no. Thank you.
Good afternoon. My name is Joshua Tsenga. I'm the country director of Phenomena Youth Association. On the media, we are known as Phenomena Positive Youth. Now, you might wonder, what is Phenomenal about me or the team? Yeah. Well, Phenomenal is an organization that is consisting of HIV positive and negative adolescents and youth. The main focus is to maintain or to help them achieve undetectable viral load, or should I say, U equals U. But how do we attain that? Our goals are to make sure that our environment is stigma-free, discrimination-free. But in order for us to achieve that, there should be acceptance. I don't know how many people in here have tested for HIV. Do we know our HIV status is? Okay, that's very good. So I'm sure we have a few people that are living with HIV. The main focus of us coming up with this organization was to ensure that, or to help each and every adolescent that is living with HIV to accept themselves, to have that sense of belonging. Majority of the people or of the youths who are maybe 20, 18, below 30, they were born with HIV. But the organization did not restrict only those who are living with HIV, but it's an inclusive organization. So if somebody is having a heart to make the change, they're more than welcome to join and give in their contributions. If you look at the word itself, Phenomenal, it's something unique, something that is extraordinary. Now, what makes us extraordinary? We're able to talk about real life issues, the things that are affecting people that are living with HIV, like adherence, treatment, HIV life journeys, real life stories, because this is where this is something that is not really talked about. HIV issues are things that many people don't want to talk about. Even in our families, we are living with our parents, our uncles, our aunties. HIV is something that is taboo, that many people don't want to talk about. But as a youth-led organization, we are trying to change that narrative. We are trying to make it, to get it exposed, There is no shame in living with HIV. There is no shame in living with HIV. We are talking about reaching undetectable viral load. For a person to achieve that, they're supposed to have the psychological freedom. Somebody is able to take medication whenever they feel like. We have many people, maybe even some of you are in colleges, some of you are in universities, and many people are very not free to take their treatment. A lot of them are hiding, trying to stay adherent to ARVs, and you're afraid of what your roommate will say about your HIV status. So as an organization, what we're doing is we are not only focused on media. We are on Instagram, we are on Twitter, we are on Facebook, but our works are not there. Our works are also on the grounds. We have a lot of people that reach out to the page. And they ask questions. Some of them are on treatment. We try to reach out because we are affiliated with the Ministry of Health, and we try to ensure that the person who is on treatment gets their medical services, or should I say their ARVs on time, so that they are able to stay on treatment. When I look at the audience, it's filled with a lot of youth, and we have so much to offer to the community, so much to offer to the world. But the same youth who are living with HIV, we are in a transitioning mode, from teenagehood to adulthood. There's a lot of complications that comes in, especially if one is living with HIV, where they struggle with, why me? Out of all my family members, I'm the only person who's taking who's on treatment. We try to offer psychological help to the teenagers, to the youth. We try to be there and encourage them that you are not alone. Believe me, it's not an easy journey, especially through the phase. A lot of adolescents and youth try to, should I say, we are led by peer pressure, and we want to fit in. Our friends who are HIV negative, they are doing drugs, and we want to fall in. We want to fit in and do everything that is not able to expose us that we are on treatment. But that is one barrier that disturbs one's positive life. In order for one to attain positivity, the surrounding should be very free. The surrounding should be very supportive. Hence, as an organization, we are trying to promote positive living, ensuring that there's the transitioning mode from teenage life, from adolescency, teenagehood to adulthood. It's a smooth journey because we have a lot of people that have gone public their HIV statuses, and they are very great examples. And we use that as we enter our communities, because HIV has not left anybody. It's either you are infected or you are affected. The group is now is consisting, or should I say, members consisting being in the group. We are growing. I loved what the doctor was saying, that the transitioning mode where the brain is aware of the surrounding. You start to be realizing that you're able to, there's a deep voice. To the ladies, you're able to identify that you're having a pimple. And all these sexual emotions are creeping in. Now, how do you help somebody who is in that situation? Because there's a lot of experiment that comes with it. As an organization, we try to be there for this person, for them to be able to understand that I'm HIV positive. But despite that, I have a bright future. I need to concentrate with school. I'm not dying today. And I have a lot to offer to the society. So in short, we try by all means to offer positive living. We also try to talk about sexual reproductive health, because, as I say, a lot of hormones are flowing in us, and a lot of changes with us. And we can't say that I'm going to have sex. So the best thing that we do as an organization is try to reach out into our communities, especially the health centers that we are affiliated in, and reach out to these kids who are collecting drugs from these health centers, and try to make sure that they are aware that if I indulge myself in unprotected sex, there will be reinfections. I don't know if many people of us are aware of the term reinfections. Reinfections is whereby somebody is living with HIV, but in addition, if they are exposed to HIV again, let's say they're having unprotected sex with somebody who is positive, they are bound to get reinfections. Way back, we used to hear a term like, I'm already positive, so there's no point in me using condoms. Or there was a term that was circulating some years back of somebody who is positive and they want to infect more. Actually, that's not true. It doesn't work like that. The thing is, you end up reinfecting yourselves, and it's getting somebody closer to death. So reinfections are very true, And we try by all means to ensure that that information get to reach the communities, get to reach the youth, especially those who are accessing treatment from the health centers. One thing that is very surprising with our generation, we are very much afraid of getting pregnant, to getting STIs, HIV, and that's, I don't know, I can't call it nature, but it's just not right. So we ensure that we promote sexual reproductive health, just bring out the awareness of the importance of them getting to know about themselves. Imagine this, a positive youth having a girlfriend or a boyfriend. They are not aware of each other's statuses. Now the problem comes in when the two who are not even having vital information and are not even using condoms. It's a risky, you know. You get to get the other type of the HIV that this one is having, and you get to have a high viral load. As an organization trying to aim for a person living with HIV to attain undetectable viral loads, U equals U, we ensure people are alert of things like that, of high viral loads, the importance of knowing the CD4 count, and everything that is necessary. Now, how do we reach out? We have media pages like Facebook, Instagram, and Twitter. We have a lot of messages that flowing each and every day. Questions, people complaining how the boyfriend was unfair, how the girlfriend did not say her HIV status. But this is my honest truth to you as a youth. Your health, your life, your responsibility. You cannot blame anybody for your actions because you have the right to say no to sex. You have the right to say no. You have the right to say, I want to use a condom. With the help of UNAIDS as one of our partners, we're trying to make sure that we reach all the 10 provinces of the country and try to make a difference in a youth that is living with HIV by being bright examples, being good examples, being role models to the society. Why do I say that? I'll give myself as an example. I was born with HIV. I was born some 31 years ago. I discovered my HIV status when I was 14 years old. It hasn't been an easy ride. I remember at 15, at 16, I entered a gang where I just wanted, somebody to stab me and make the death come quicker. Now, with all those experiences that myself and some of the people that have gone public, their HIV statuses have faced, we are trying by all means to be best examples to the society and make that difference. I say again, your health, your life, your responsibility. Thank you very much.
So much. Thank you so much. Okay. Any questions for him? We have so I'll take 5 questions. First 5. Okay, let me start from there and I come this side. Please summarize your questions.
My name is Chisandra Rebecca and I'm from Lusaka province. I'm representing Young Women in Action. So I heard him talk of them trying to make the people that move around with ARVs try to move freely so that they're not stigmatized or so that they're not condemned. But what strategy do you think is going to work for that? Because for as long as we keep on thinking that you can only get HIV and AIDS through sexual intercourse, we are not going to be free. Whenever someone has HIV and AIDS, we Zambians always think it's because the person doesn't listen, forgetting that even sharing of sharp objects, you can get HIV and AIDS. Thank you.
Thank you. Okay, let's take the 3 questions and you answer.
My name's Lee Mvula. I have a question for you, sir. What are some of the measures have you put in place to monitor the progression of the viral load, and how are you tracking down new clients? And what happens to the fellow partners? For instance, I'm HIV positive. What happens to my partner if you just track down me? What will happen? And do you have specific areas or clinics where you're just working on? Thanks.
I think let me just get the first one and the second one, then another. With the first question, we really don't have to be ignorant with HIV. I think days are gone where we used to think like the only way we can get HIV is through having sex. Myself, as an example, I was born in 1999. Discovered my HIV status when I was 14. I was still a virgin. So there are many modes of transmission through accidents, sharing sharp utensils, unprotected sex. There are many modes of transmission. The best thing that we can do as an individual is to be aware of yourself. Take care of yourself. Know what you're doing. Do not live your life into another person's hands. I've come across a lot of information where a lady or a gentleman is complaining that she did not tell me that he's HIV positive or she's HIV positive. But then again, the blame game will always continue. We have to be alert. We should not put a blind eye to HIV. We are supposed to know the modes of transmission. We're supposed to know the importance of having this information. Share the information you're having, especially from platforms like this. You have information firsthand. At least we expect you as an individual to take the information that you've gathered and share it to somebody that really needs it. There are many modes of transmission. You cannot only get HIV through having sex. No. There are many modes of transmission. But we have, as I mentioned, our generation is more worried about getting pregnant than getting HIV, especially with the prevention measures that have come in place, like PrEP, PEP. You know, people are exposing themselves. But it shouldn't be like that. The aim is to end AIDS by 2030. You have a role to play. It is your responsibility. Then what are we doing? We ensure whoever we have tracked down to become a friend. You know, the aim is to ensure that that person attains undetectable viral load. So as an organization, there are many things that we've done, especially psychological help, physical help, where we do one-on-one interactions, one-on-one counseling, visitations, and a lot. Then we also try to make the person to be aware that death is not coming. Believe me, I think about 80% of the people who are living with HIV, they've thought that I'm dying anytime soon. And then a year goes, another year goes. I remember being, as I mentioned, I entered again by the time I was 15. The whole idea was maybe somebody would stab me, but I remember being stabbed and I didn't die, you know. Then I realized, okay, so life goes on. Then I started to rechange my thinking, you know, I started to create something that I can be. I came out public when I was 17. I remember having a lot of stigma in my community. Somebody could just step in front of you as we are going to school and say, oof, you know. Yeah, that's life. But fast forward to today, 15 years later, I think I'm in a very, very good position. I'm not only a director of the organization, but I'm also one of the co-founders. We have managed to make a lot of change to the youth that is living with HIV. There is hope at the end of the road. It's actually, it doesn't even have the end. The end comes when you decide to give up. That's when the
Insightful, and that is an amazing initiative, by the way. So my interest is on the tracking system that you guys have. You've mentioned that your organization consists of people living with HIV as well as people who are not living with HIV. So my question is, how do you track these people living with HIV? Do you guys provide services like rapid testing and maybe counseling and whatnot? And in an instance where you track maybe these young people, or maybe people generally who are living with HIV, what interventions or what measures or what help do you offer to them? Because I feel in as much as you may offer information, which is okay, but it is not sustainable because they need services like ART. So do you offer ART, or maybe what sort of help do you give them? Thank you.
That's a very good question. So the team, the phenomenal team, is consisting of a lot of members. We have lawyers, we have doctors, we have nurses, we have teachers. You know, these people, we've seen each other grow, you know, and we are in different fields. So what we've done is these people who are in medicine, we've formed some teams, and we are in health centers thanks to our partners, the Ministry of Health. They're trying to help. It's why we are trying to make sure that we are in every province so that we are able to reach each and everyone. The focus is not only the people that are in town, you know, having electricity. We are trying to reach even those rural areas where information is not reached. We are not only trying to give the information, but we are also trying to offer the services by getting the medicine on behalf of the client and delivering to the client. Then they are able to just visit the health center when they feel like, or when something is very, very sensitive, especially in this COVID period.
Okay, so I found it interesting that you're talking about because currently we are struggling with keeping young people on treatment, especially for adolescents and children. For example, we have around 10,000 adolescents who are HIV positive but are lost to follow up. We have, again, 11,000 children lost to follow up, not on treatment. So what strategies are you using to keep AYP on treatment? And how has this been effective with the young people that you're working with?
Okay, that's a very good question. You know, if there's one one category that is very difficult to deal with, it's a youth or adolescents, because especially those who have not even been told their HIV statuses. They've been on treatment, they've been taking tablets. Maybe he or she is the only person who takes the treatment, him and the mother, or her and the mother. And then this person realizes that he's been on treatment, he's been on ARVs for quite some time, and they hope to stop. So what we do is we try to reach out, because our focus is not only on media. We try to reach out and bring out the vital information, like U equals U. U equals U, it's like it's like the sun in the darkest room. You know, it's just the bright sun. Because if somebody is undetectable, they cannot transmit. But this doesn't mean that the person is HIV negative. I'm sure we've seen some stories on media where somebody says, I've been on treatment, now I'm healed, they've prayed for me, I'm healed. That's not actually the case. We have not gotten to the point where people are healed, but the goodness with the revolving of treatment, changes that are in with science, you can reach undetectable viral load. That is only achieved if adherence is there. And if adherence is there, then this person can attain undetectable viral load. So we are insisting and preaching about U equals U, because, you know, imagine somebody who thinks, I cannot have a family, I'm going to die anytime soon. Then you tell them, if you continue taking your treatment, you might even get negative results. But it doesn't mean that they are negative. It means the medicine is working very well. So our importance is ensuring that the U equals U message reaches, because it is life-changing. And so far, so good. We've seen some changes with a lot of the members who have tend to be undetectable, and they are doing very, very well. There's a question there.
The last one. The last one.
My name is Lako, coming from Southern Province. I feel like the question that was posed on how do you make a follow-up on the adolescents that are lost to home is not answered. So kindly help us.
Okay. So, as I mentioned, we are in health centers and we're trying to be in a lot of health centers. With the help of the medical personnel that are working with the Ministry of Health, we're able to identify somebody who has not returned to the health center maybe two months or has not collected the drugs, maybe for the time they were supposed to collect the drugs. So what we do is we make follow-ups. All the laws to follow, we ensure that they are followed up. The team follows them up wherever they are, and we ensure we find out the reason why they have not returned to the health center. And if possible, we try to provide the help that is necessary for the person to come back. For example, as I mentioned, we have people that are living with HIV who have even gone public with their HIV statuses. So we use these people as examples. Look, man, he's HIV positive. She's HIV positive. She has been through this and this and this and this. I believe there's no better example you can give than to give somebody who's in the same shoes. I feel reason we've had a lot of loss to follow-ups is because of maybe the services. You know, somebody goes to the health center and finds a clinician or somebody who's giving them caregivers who just gives them drugs and they go. They're just doing their works. But if somebody gets to see somebody who is in their shoes, it is life-changing to them. So we try to be best examples that we can be to the society. And it gives hope, trust me. We've seen a lot of changes, and people who have even stopped treatment, they resumed treatment, and they're doing very quite well.
Thank you. I believe all the questions have been answered. We can put our hands together for him. Thank you so much. Thank you so much. Okay, so we'll continue with yesterday's discussion on the age. Okay. So we'll be joined by Dr. Simpungwe on the update of adolescent health situation in Zambia. This presentation will be 15 minutes. Then we'll receive questions from the audience. Over to Dr. Simpungwe. Over to you, ma'am. Doc, you're welcome.
Thank you so much. Good afternoon.
Good afternoon.
Am I able to share my presentation?
Yes.
So thank you so much again. I'll just give you an overview of the adolescent health program in Zambia, where we are at as a sector. So it's just a few slides. I'll just focus on highlights. I can't manage to present everything we are doing as a ministry with our partners. So this is the outline of my presentation. I'll talk about the background, the adolescent health focus areas for the ministry, the current status of adolescent health service provision, existing gaps, and work in progress. Then I'll conclude. So this is just a background on adolescents. So we are talking about the age group 10 to 19 years, a period characterized is characterized with rapid growth, the desire to be independent, and the acceptance by peers. I think we are all aware about these characteristics of an adolescent. Adolescents explore the world around them, they experiment so that they appreciate their limits, and sometimes also to identify their own personalities. So it's a time, again, which is very, very critical because during adolescence, a negative or positive trajectory is established. So it's a very, very important stage for us to intervene. In as much as young people are growing and appear to be very knowledgeable, advanced, especially with issues to do with technology, they have difficulties in making responsible decisions, especially during early adolescence. So they need guidance. This is the more reason why we are interacting with young people. And adolescents' concerns, as most of you will confirm, is concerns. The adolescents are concerned about issues that will give them satisfaction and enjoyment today, and they don't foresee the consequences in the future. So healthy and unhealthy practices are adopted during adolescence, and most of these practices also last a lifetime. So if for instance, you are into physical activities, doing sport, the likelihood that you continue engaging in physical activities in adulthood is very high, and the opposite is also true. Okay, so what are some of the contributing factors of poor health outcomes that we've identified in Zambia, and I think across the region? It has to do with the quality of parenting. I think we've noted with concern that even getting feedback from young people that parents are no longer providing the leadership, the guidance, the counsel that young people require. Most of the parents are absent. They've forgotten about setting limits, boundaries. Some of them are not even able to provide basic needs. It's like it's frozen. Okay. So the other factors are individual. So we have individuals with or adolescents with low self-esteem, low confidence. They don't have adequate knowledge on health issues for them to make informed decisions. Negative peer pressure. Of course, some young people find themselves affiliating themselves to young people with antisocial behavior, and thereby also engage in risky behavior. Then we also have unprotected environment in our communities, easy access to alcohol, gender-based violence issues. We also have transactional sex issues. So all these factors have contributed to the poor health outcomes that we are noticing among young people. So as a ministry, working together with partners, what are we focusing on? The adolescent health program in Zambia is guided by the adolescent health strategy that will come to an end in 2021. And these are the 6 focus areas that our program is striving to address: the sexual reproductive health, HIV and STIs, gender-based violence, non-communicable diseases, which include mental health and nutrition, as well as alcohol and substance abuse. And we are also mandated to ensure that we take care of the needs of adolescents with special needs. So adolescents with special needs include adolescents living with disabilities, those the ones who are incarcerated, adolescents in refugee camps, and in our case we also include street kids and those living with chronic diseases, HIV, heart diseases, hypertension, as well as diabetes. So what have we done as a ministry working together with our partners? Currently we've trained only over 600 health workers and 2,000 peer educators in adolescent health. This is not a lot, as has been confirmed by most of you. I think so many health workers still need to be trained so that they appreciate adolescent health issues and provide adolescent-friendly and responsive services. Across the country, we only have 53 districts that have between 3 to 5 spaces, adolescent health spaces, which is not a lot for us to attain the desired results in terms of providing adolescent-friendly services. And then we are also focusing on integrated outreach services so that we are able to reach out to young people in their communities, schools as well, and tertiary institutions. And working together with partners and young people, have also managed to produce a number of IC materials, information, education, and communication materials. And we also have programs on social media, for example, the Tune Me program, and also the U Report, which have also been platforms young people have utilized to access health information on various health topics. Then we've also utilized radio and television programs like the Chikambi program, Face Your Life, supported by UNICEF and implemented by National AIDS Council. So these are some of the platforms we utilize to reach young people with health messages. And then we also have helplines, the 116 child helpline, the 5,600 and the 993 GBV lines. So these are all toll lines that young people access to obtain information on any health program or problem, and also information where they can access services in their locality. And then we are not working in isolation, because we realize that most of especially the contributing factors to poor health outcomes are beyond the health sector. So we strive to collaborate with other ministries, like the Ministry of General Education, the Ministry of Higher Education, Gender, Youth, Sport and Child Development, the Ministry of Chiefs and Traditional Affairs, as well as the Ministry of Guidance and Religious Affairs. So these ministries implement comprehensive sexuality education program, youth empowerment, ending child marriage initiatives, just to mention a few. Okay. Then we also work with civil society organizations whose main mandate is to advocate for availability of adolescent-friendly services, and we also enjoy partnership with implementing partners who are engaged in demand creation, stakeholder coordination. They also help us train health workers and peer educators, and also sometimes also participate in the actual provision of adolescent health services, especially in family planning and HIV program. And young people have also been engaged, especially at national level and provincial level. So they've used their networks to pursue accountability of the health system. I think we are talking about meetings such as the one we are having now, where young people give us feedback on how they want the services to be provided to them. So these platforms have really helped us to shape our programs and also to improve them. Then advocacy, young people advocated for a number of things. Some of the recommendations have also helped us develop documents such as the adolescent health strategy, which we are implementing. Then young people have also been involved in designing and delivery of health messages. The examples I gave on programs that are run on television, radio, and also in adolescent health spaces. Some of those programs are actually implemented by young people. Despite the recorded successes that I've just highlighted, we still appreciate that we have a lot of work to do. So there are some challenges, existing gaps that we have observed and that we are trying to address. So inadequate health facilities providing adolescent-friendly services, as I mentioned earlier on, we are only in 53% of districts, and only a few facilities have adolescent-friendly spaces. In most facilities, the service package is not comprehensive. In some facilities where we are providing so-called adolescent health services, I think we are just focusing on condoms or just contraceptives. So we really want to have a comprehensive service package, as I highlighted in the previous slide, where I indicated the 6 focus areas for adolescent health. So we are supposed to really provide services that will speak to health, mental problems, to GBV, to non-communicable diseases, not just focusing on SRH. Then low health literacy levels among young people. I think the Zambia Demographic Health Survey findings when it comes to comprehensive knowledge on HIV, on reproduction, I think the findings are not so impressive. Less than 50% of young people have accurate information on health problems, and that is of big concern to us, because you can only protect yourself and engage in good behavior or make informed decision if you have the right information. So we are really concerned about the fact that young people are not, they don't have adequate information, accurate information on most health problems, and that is working against them and against our set targets. Then we also have identified that we have an equitable program coverage. Most of the programs, especially those that are partner supported, localized in urban districts, especially Lusaka and Copperbelt province. So we are concerned that young people living in rural provinces and districts are not getting the kind of support and services like their counterparts in urban provinces. So why are we recording slow progress? It's like we haven't attained our set targets. If you were to look at the adolescent health strategy and the national health strategic plan, I think one of the indicators we have in those documents is to reduce teenage pregnancy from where it is maybe to about 25, but it's like we haven't made any progress, especially in teenage pregnancy. It was 20%, 29% in 2014, and it's 29.2 in 2018, according to the Zambia Demographic Health Survey. So we haven't made a lot of progress. HIV, new infection rates are not reducing at the rate we would want to have it reduced. So we've been discussing and asking ourselves, why are we making slow progress? So these are some of the things we think have contributed to our non-achievement of set targets. So efforts are not implemented to scale with adequate intensity and duration. So sometimes we have very good projects, very good programs, but they are only implemented in selected facilities in a few districts, and the intensity sometimes is like it's not done maybe with that consistency and impact which will bring about the desired behavioral change. And most of the projects actually have an end. So you find that such efforts, such interventions, such support actually won't help us to attain the desired objective, especially if you look at indicators at national level. We'll have some impact at local, facility, community level, but it won't translate into changing the picture at national level. Then interventions focus on health services without addressing the unprotective environment. We have issues that affect young people at home, in the communities, things which are beyond the health sector. So if we just focus on giving information, we don't address issues of dropping out of school, of easy access to alcohol, of sexual, gender violence, and those unprotective factors that are beyond the health sector. I think if we don't address those, we won't attain the desired results. Then programs are also implemented in silos, like we are not collaborating with other sectors and other organizations to ensure that our efforts are collaborative in nature, so that we leverage on the limited resources. So what are we working on as a ministry? So we are increasing the number of health facilities that offer adolescent health services through continuous capacity building or training of health workers and peer educators, and we are grateful to partners. A number of partners are helping us in this undertaking. Then we are also strengthening integrated outreach services, especially now that the COVID-19 measures have been relaxed a bit. We want to revert back to undertake outreach activities, of course, observing the COVID-19 preventive measures. Then developing diverse health education materials on all priority areas so that our young people have accurate information on health services for them to make informed decisions. We also want to strengthen linkages with other ministries and organizations so that young people can access social services beyond the health information that we are able to offer as the health sector. Then we are also considering designing programs that will target adolescents with disabilities and those living in rural areas We are glad to report that with support from partners, we managed to translate a number of IC materials into sign language. And as I speak now, I couldn't be with you physically because I'm in Fringier and we are working with young people with disabilities also, trying to get their input so that we can design our programs that respond to their needs. Then we also develop messages and programs targeting parents and community leaders. We have one video which is targeting parents so that they find time to have constructive communication with young people to help them make informed decisions. So you start seeing that video running on social media and ZNBC radio and television. So in conclusion, we are saying the Ministry of Health has prioritized adolescent health and young people's health. And we also admit that adolescents' behavior influenced by personal, social, and cultural factors. So it's not just information, even the environment surrounding them has a role in how they behave and how they respond to issues surrounding them. So improvement of adolescent health outcomes will be attained through implementation of interventions that will target multiple systems. So it's not just the health sector. We need also to target the local authority, the school, Ministry of General Education, the parents, traditional leaders, religious leaders, consistently. I think that's how we are going to see the desired change, which all of us actually striving to see. So thank you so much.
Thank you, ma'am. Thank you so much. Thank you so much. We are going to take 3 questions. Sad Zambia.
Yeah, in your presentation, you have.
I'm sorry. Northern Province, those from Northern Province, please, you may just walk out for a few minutes. Those from Northern Province. So we over to you.
Yeah, in your presentation, Dr. Simpungwe, you have highlighted that sustaining youth programs has been a challenge. My question is, having noted that, what strategies have you put in place to ensure that these programs for young people are able to live beyond donor funding, and that we have domestic funding to ensure that these programs are sustained and they have a future beyond what donors are able to support?
Thank you. Over to you, Doc.
Well, maybe I can get 2 or 3 questions instead of just getting one at a go. 2 to 3 questions, I think it will be easier and faster for all of us.
Can I have the second question?
My name is Faustina from Livingston, community facilitator under Zambian Youth Platform. So, there are a number of small bars, I'll say popularly known as shabins, and different communities. So, I wanted to ask, is there anything that can be done for young people running such businesses, looking at it's one of the major chain link to new infections and abuse of substances such as alcohol? Thank you.
Thank you. The third question. The third question from Kabwe.
Okay, so my name is Zulu Frederick, and I'm a SRHR activist based in Kabwe. My recommend is not a question, but it's just a recommendation as well as a solution. You did talk of having challenge to reach the target in the look at the decrease of teenage pregnancies across the country. So my recommendation is let the government, through the Minister of Health, increase funding in adolescent spaces across the country so that these adolescents can conduct outreach sensitization in communities, because most of the times they feel it's a challenge to reach out because they don't have funds. At the end of the day, they're using their own pocket resources. So there must be increase in funding in adolescent spaces across the country.
Thank you. Can we please have one meeting? Over to you, Doctor.
Okay, thank you so much. So I captured two questions. One was a recommendation. So the first one was on strategies to sustain donor-funded projects beyond donor support. I think what we are working on as a ministry, if you recall that slide I showed you on the different focus areas for the program, there was HIV, there was SGBV, there was mental health, non-communicable diseases. So if you look critically at those programs, they are actually programs that are separately funded, apart from looking at adolescent health. So our strategy is to ensure that those programs have a component to support adolescent programs. So say if the TB program is planning for interventions to address tuberculosis, community sensitization on tuberculosis, our new approach will be that there should be an allocation to target young people, sensitizing them on TB. Same with HIV, same with other non-communicable diseases. I think in that way we'll be able to sustain some of the interventions that our partners are supporting. And then, of course, we are also looking to have increased funding to the program, which will go more, which will be outside a program-specific funding. But as long as the program we've listed in among our priority areas is funded, we'll ensure that we get a share so that our funding is increased. Then the issue of shabins, young people involved in selling illicit alcohol, I think this is the more reason why we are saying we need to strengthen our linkages, collaboration with other line ministries, especially the Ministry of Local Government. They are mandated to superintend over liquor trading, trading premises for whichever businesses. So our objective actually is to ensure that we work with the local authorities. They are part of the technical working groups, and we also have joint plans and maybe monitoring activities so that they can enforce the bylaws, which is actually part of the mandates they have. Then, although it was a comment, maybe I can also add on SRH, teenage pregnancies. We've realized and also analyzed actually the contributing factors to teenage pregnancies. Some of the reasons I think that have been advanced by young people, especially in rural areas, include the fact that they've dropped out of school, so they have nothing to do and they are under pressure to have babies. So even if you provide family planning in some rural areas, it's like it's fashionable and it's prestige for young people to have babies. And then we also have areas where there is child marriages. So that high teenage pregnancy also includes babies that are born to adolescents who are in marriage, who are in child marriages. So our approach actually is to ensure that we target messages to parents, we involve traditional leaders and also religious leaders so that they can help us address underlying factors that contribute to young people resorting to getting pregnant or falling pregnant or getting married as adolescents. So thank you so much.
Any two last questions? Not from South Zambia. Any other question? Anyone else? Okay. No question. Okay. One last question. Okay, the two questions. The two last questions. Please, they should be short, on point.
Hello. Yes, good afternoon. Thank you for the opportunity. In your presentation, you mentioned of how your progress has been slowed down due to the fact that your interventions are focused on health services without addressing the unprotective environments. So in this case, you talked about how young people still have access to drugs, alcohol, and whatnot. So my question is, what are you doing about it now that you know that despite all the effort you're putting in, you still get bad results at the end of the day?
The last question.
Okay, so thank you so much.
We get
In
the
my
last question.
presentation, I mentioned that we have factors that contribute to poor health outcomes, and I mentioned unprotected environments. So unprotected environment starts in the home. Poor communication, poor relationships between adolescents and their parents, absence of parents at home, non-provision of basic needs by parents. So that it already starts from there. And then if we move out to the community, we have easy access to alcohol, substance and drug abuse. We have gender-based violence, sexual abuse, transactional sex. So that, I think it's a range of factors that actually we want to address, working in collaboration with parents, religious leaders, and community leaders. And I mentioned that our work in progress now includes developing messages targeting parents and community leaders. And we also have opportunities where we are engaging them in meetings at technical working group level. So we have that in our pipeline, and we are strengthening our linkages with line ministry so that we can see how we can maybe identify and link, refer young people from the facilities who require services beyond what we are able to offer as a sector. So it's strengthening linkages and developing messages that will target them, just to make them appreciate the role they have to play in this discourse.
Thank you, Doc. You have one last question.
Thank you very much. Talking about adolescent healthy, what strategy have you put in place, or are you planning to do concerning the juveniles in correction facilities? Because the juveniles are put in the same correction facilities with adults. Later on, after they're out of those correctional facilities, they contract a lot of diseases. So as a ministry, what have you put in place?
Thank you.
I think as a ministry, we have just a few programs that are targeting juveniles in correctional facilities. We have partners like CIDAS, and we also have we are working with the REPSI, and I've forgotten one organization, WCM, to provide services. It will just be screening, raising awareness on health problems, under the TB program, we also have interventions that are also targeting young people in correctional facilities. But I think the lasting solution should be that young people actually should be separated from correctional facilities where grown-ups are, and that is unfortunately not within our jurisdiction. But our role, as I mentioned, it's our mandate as a health sector to ensure that our services also target young people in correctional facilities. Efforts are there, but I think we need to scale them up. As I speak now, we have a team that is planning to go to Katombora and also to the refugee camp in Wapula province, and we also have one youth correctional facility only for girls in Indola. So we have a program that will undertake next week. But I think these are efforts that we plan to scale up so that we safeguard or we reduce the risk of contracting infections in correctional facilities among young people. So there are some good practices, programs that we intend to scale up. So we are actually thinking about young people in those facilities as well.
Thank you so much, Doc. 1 minute.
Maybe I can just assure young people that we, as a ministry actually, and as a unit, we are very, very appreciative for the feedback you are giving us. I think it's really helping us to improve on our program and also to appreciate what is working and what is not working. And I would really love to hear more about what we can do for young people living in rural provinces and districts. I think we need more of ideas and suggestions so that we can improve our program. Thank you so much for the work you are doing
Thank
to
you,
help
Doc.
us improve our program.
Thank you. Before you go, allow me to call the Executive Director, Mr. Malambo.
Thank you so much for making time as usual. It was a very insightful presentation. So I'm just requesting that you probably hang on for a little bit. We had a few questions that came in from virtual participants that I would like us to beam, just in case there's anything that needs to be responded to from Ministry of Health perspective. I think it would be good for you to take some of those. And to the participants, the delegates, I think the reason for this presentation from her is to actually allow us to already have an idea of what is happening right now. So even as we go into the session of trying to brainstorm around solutions, if something is already happening, how can we speak to improving it so we just don't go and suggest everything that the ministry is already doing? Okay, so we think outside the box. If something is happening already, we appreciate it's happening. If we've seen it happen and we want it maybe to implement it slightly different, those are the ideas that we are bringing on the table. We didn't want everyone to go into this session without this very useful information, because we're just going to be saying the same things that are already happening probably by the Ministry of Health. Thank you. So I'll ask the guys, technical team there, to just beam the questions.
Hello.
That's a good question. Whoever asked that question can see me. Doc, the questions have been shared with you. I think those relating to the Ministry of Health, you can answer those.
I think this one is not Ministry of Health. Oh, this one is different. Okay, let me see. Okay. Okay, so especially at the point of designing messages, are you getting me? Hello?
Doc,
Hello?
yes, please talk. Just 10
Yes,
minutes.
so at national level, since the question of at national level, we've tried to engage and consult young people, especially during the development of messages and also programs. If you followed my presentation, I indicated how young people have been involved in advocacy. We get feedback from them regarding our service provision, like the manner we are getting these responses, and also ensure that we inform our programming. Last month, I shared again that we translated, for example, IC materials into sign language, and we engaged young people living with hearing impairment. This time where we are now, we've engaged young people to help us design interventions that will speak to their needs, a service package that will respond to their needs. And our hope is that even at provincial and district level, where activities are planned and designed, young people will also be engaged so that they can better design interventions that will speak to their needs. If you recall what I said at the close of my presentation, I encourage young people to give us ideas on how best we can reach young people living in rural provinces and districts. And my hope is that at that level where you are, provinces and districts, you also add a voice whenever meetings are called, so that you can help the service providers, the health workers, to design programs that you'll be able to implement, spearhead, and on as young people. This one is saying, where adolescent girls, what? Where Okay, I think maybe someone should read since you are flipping the the slides. So adolescent girls and young women, we as young men too need something that will enable feel like we are part of the boat. Yesterday's session, okay. I think what partners and what I think about is yeah. So as Minister of Health, we are not focusing on a girl child. Ministry of Health is adolescent health. There's nothing like adolescent girl and young women. As a sector, we are focusing on adolescents. So both girls and women are our priority. And if you look at even the way we provide services in our facilities, uh, um, like adolescent spaces that are manned by health workers or that are in our facilities, there's a girl and a boy adolescent peer educator so that they're able to attend to a peer who is of the same sex. So as a sector, as Ministry of Health, we don't differentiate between the two genders. We want both to get information. I think this is also true for the Ministry of Gender Education. So where you find like girls only, those are partner-driven programs. Our mandate as government is to ensure that both adolescent girls and boys get the information that they require to make informed decisions. Next question. Come again. Come again.
1 minute, Doc. Can you hear
I can't
us,
get
Doc?
you.
Hello? Hello, Doc, can you hear us?
I can hear you now.
Yes, so I'm going to read the question in full. There might be parts you've already highlighted or touched, but I would like to read it in full to get a full overview of the actual question. Then at the end, you might fill in the gaps. The question reads, "Good morning. I hope this mail finds you well. My question is, what interventions are there for the adolescent boys and young men that will enable peers feel included and never left out? Many are activities done or centered for AGYW. We as young men too need something that will enable us, I believe that's us, feel like we are part of the boat. Yesterday's session, I heard someone speak about age. What is the government and all partners thinking about this? Many are times where adolescent girls and young women are abused. They are vulnerable, mostly in rural areas, because they don't know about consenting. This also takes me back to contraceptives, the eligible person to access these methods. So the questions are: one, what interventions planned for adolescent boys, young men? I believe you highlighted some of those. Age consent should be a primary responsibility or secondary. The third one, contraceptive awareness. How can a community-based organization engage with the principal recipient in order to raise SRHR, which may be a sub reception, might not be preview. Recipient might not be preview. This is from Philemon, Resilient Youth for Change. I don't know if you can try to touch on some of the questions that you might not have answered, Doc.
Okay, so interventions planned for adolescent boys and young men. We have good practices by some partners who have boys-focused interventions, like the grassroots soccer. So we intend to work with young adolescents, peer educators. They have ideas. So maybe I can't even say at the Ministry of Health, this is what we intend to do. Since I've already explained that as a ministry, we are working with both female and male adolescents in our spaces. they suggest to us like how best we can reach young boys. So they've requested for things like outdoor sporting equipment, jerseys, footballs, even indoors games like chess. So we are getting recommendations from young people in terms of how best they can reach their peers with health information. So we use proven strategies, sports, and also working with trained male peer educators to reach their colleagues. And we also want to strengthen outreaches, as I earlier on mentioned, to schools, to communities, and to tertiary institutions. And of course, in our outreach teams, it's always a must that we have both gender represented, the female and male peer educators, so that they are able to engage with peers of the same sex. Then age of consent should be a primary responsibility or secondary. I'm not sure what the question is, but in as much as we are trying to propose the age of consent for young people to access health services, I think there are efforts also for for harmonization between customary law and statutory law. Say, for example, in terms of marriage, I think there's a need for relevant ministries to ensure that we have maybe an understanding in terms of at which age can we consider an adolescent maybe mature enough or responsible enough to get married. So we have, as I mentioned yesterday, we have two laws that govern Zambia, customary law and statutory law. So we need to harmonize that so that even the age of consent doesn't bring confusion, especially to service providers. Under customary law, you have young adolescents who are married, and it's okay, acceptable under customary law. But on another side, we are saying young people are not yet mature, their bodies are not yet strong enough to carry that pregnancy and to also maintain their health. So we are working towards that. Other ministries will look at harmonizing the age for marriage, but we also just focus on providing a policy on the age of consent for health services. Contraceptive awareness, I think this is just one of the many messages that we want to come across to reach young people. So as I mentioned, we need to have comprehensive messages, and that is what we have developed and we are still developing. So our messages won't just focus on contraceptives, because we realize that there are other factors that are contributing to teenage pregnancy beyond contraceptives. There are people who want to be pregnant because it's prestige, because they'll get support, because they'll be recognized as adults, and some are, it's out of sexual abuse. So we want to go beyond contraceptive awareness. It will be part of our messaging, but we want it to be comprehensive. And we want partners and sub-recipients also to appreciate the fact that we are advocating for a comprehensive package, not just focusing on one program or not just focusing on contraceptives, because there are other issues that affect young people and contribute to risky behavior, including HIV infection and teenage pregnancy.
So much.
So these are so the community-based organizations, please get in touch with district health officers and work with them. I think sometimes you find that partners are maybe lagging behind because the collaboration and collaboration with districts and facilities, I think, is not as strong as it is supposed to be, because we are developing guidelines at the Ministry of Health and passing them on to sub-national levels, and we expect all partners to work closely with us so that we move together and we don't leave any recipient without information that they require to disseminate to their clients. So comprehensive messages is our new approach as a ministry.
Doc, thank you so much for your response to those questions and the presentation. Please, can we put our hands for Dr. Simpongwe? Mr. Malambo. Okay. We'll be going into group sessions for 20 minutes. Only 20 minutes. We are behind time. So we'll have 15 minutes. 15 minutes. Mr. Malambo. Mr. Malambo. Mr. Malambo, over to you for the group sessions. So before we go for the group sessions, we'll go for a group photo. A group photo. Before breaking away into the group sessions, we'll have a group photo. But before the group photo, Mr. Malambo will give us the groups we are going to go in, who's going to go where in terms of the province. And remember, we have 15 minutes in this, 10 minutes. 10 minutes. Plus extra 5, so 15 minutes. Thank you.
I know there were two other questions which were asked earlier. One of them was speaking to materials. I think we'll be sharing most of the presentations. We'll share them via our website. And for those that want us to email them to you, especially to the virtual participants, we should be able to send them over to you. But I think all materials will be available on our website. We'll create something there where you can access everything that has been presented here in this meeting. There was another question around accessing Global Fund support from Philemon as a sub-recipient. So for principal recipients, they advertise. Right now, there's an advert in the papers from CHAZ, the Churches Health Association of Zambia. They are one of the two principal recipients that receive Global Fund money, and they sub-grant to other organizations to implement. So CHAZ issued their advert early this month. The deadline was supposed to be Tuesday, 22nd. I've just seen an email, they've extended the deadline, so it's going up to the 4th of January to actually submit your proposals. If you have something that you think you can actually do, apply for that funding. There are different levels of funding. There are lead sub-recipients, and then there are sub-recipients that will be receiving money as well to implement. So let's not just talk. So if you have an intervention, you have an idea, let's apply for that funding. So even those materials, I think the calls for proposals will also ensure that they're available on our website. So what we are doing now, the solutions, this is the core of this whole engagement. Yes, we have learned a lot over the past 2 days, but now we've come to the point where what we do today and this particular moment will determine how relevant this conversation is and how long we can go on conversating with each other and with other players. They've been here listening, some of them following virtually, some of them here with us. UNESCO has been here from the time we started. Up to now, they're still in the room. So the challenge is upon us now to put together those solutions. So make it simple. We know that HIV is still one of the major challenges affecting young adolescents and young people. Adolescents are still dying unnecessarily from AIDS-related deaths, which shouldn't be happening. There are more and more new infections among adolescents and young people. Again, that shouldn't be happening. There are issues of pregnancies. that are also growing every year. And personally, I think that the retention policy is a failed approach to resolving the problem around pregnancy. An example is over 2,500 adolescent girls drop out of school in a year. Less than half of that actually make it back into school. Where do the rest go? So maybe we need to focus more around prevention. How can we ensure that we minimize those pregnancies or reduce them by all means? The other one is just around access, generally access to health services for adolescents and young people. The issue we keep talking about, the youth-friendly health services, youth-friendly health corner. I think the focus should be around the youth-friendly health system, a system that's responsive to the needs of the young people as far as health access is concerned. So we'll have those three groups. The challenge is on how we actually get to divide ourselves to get into these groups. And we're only doing two things. We are identifying 5 key issues that we think are contributing to this problem. And then we are also agreeing on 5 key solutions to this problem in the order of priority. So that if an agency or a partner is going to pick one solution, if they're prioritized, they'll know that number 1 is your preferred solution. If they're picking 2, they'll pick the first 2. Are the instructions clear? Now I'm worried because we're even talking about group photo, people look gloomy. And to look at the Indaba was just awful on the group pic. Am I clear? Okay. So now, on how to get into groups. I know that we are not evenly distributed. There are certain provinces that have more people in the room, so we can't go by province. Or can we just cut the room into some sections? We can? Okay. Except I don't want all backbenchers in one group and everyone from the front in one group. There are certain characteristics that go with where we sit. Pardon? Yeah, or maybe we could start with the groups we used yesterday. Yeah? So those that were outside in the room across, we'll go there. The ones that were at the other room, the other side, we'll also go there. So whichever group will have very few people, will be able to move some of you. But as requested, I would really like us to start with the group photo. It's the only opportunity we have. After this, when we're done with the groups, it might be dark. And some of us, like Nand, are a bit dark. So if it's dark, we might not be visible on the pic. Yeah? So it's better we do it now. Then afterwards, as we close, ZYP would like to launch our website today. So during that particular event, just 2 hours, as we launch the website, and also show you how to actually join to become a member via our website. We'll also be joined by Roberto, who will be performing here. And we need to surprise him because it's his birthday today. It's his birthday today, so we'll sing happy birthday. I was hoping I could find someone to tell me where I could get a good cake, like a really nice cake. I still don't have leads yet. Oh, you do? We need it now. Okay, so that's what's happening tonight. For now, but this is dependent on the good product from the groups. So we can now go for the group photo. Afterwards, we go into our groups. Thank you. Hello, people. We are out of time. Can we move, please? Group photo.
Group in, hello? I can't see any group in here. We need to have one group in here. You'll be dealing with teen pregnancy. One group. One group. You are eating in 15 minutes.
Let's wind up. Let's wind up.
Hey, 1, 2. Okay, whatever you have, you present. Whatever you have, you present. Leaders keep time. The group leaders come near, please. Two. Can I have the group leaders, please?
Excuse me? Are there any people that have left receipts at the lodges they're coming from? Is there anyone that has left a receipt, bus receipt?
Group leaders, please. If you are a leader, a group leader, please. Can you do justice? Group leaders, can you do justice, please? Can you see me now? Group leaders, can you see me, please? Those that are presenting on behalf of the groups. Group leaders. Okay. The first group is here. Can I have all the group leaders, please? Group 1 is here.
We switched off. Where's the switch? I want to switch you on. We look very off. Eh? Komboke? Achandana ke. Ataba what? Okay, so get ready for my performance. So you guys, where are the group leaders?
Okay. Can we have the first group?
please introduce yourself, the group. The other group leaders, please, can you see me now? What you are looking at? Yes. The other group leaders, please see me. Group leader? Those that are presenting on behalf of their groups, please see me now. Okay, group one. Can we have one meeting, please? One meeting. Let's pay attention. We do the group presentation quickly. We go to our next session. We're waiting for our call. But if we delay, we might miss him. Thank you so much. Group one, please.
My name is Faustina from the back group. Our topic of discussion was problems leading to teen pregnancies. So we first listed the problems that causes teen pregnancies, and then the problems that we came up with was child neglect, peer pressure, poverty, early marriages, and traditional beliefs. So, and the solutions that we came up with on under child neglect was educating parents on sexual reproductive health, and also talking to them, teaching them on how to approach their children, on how best to approach their children. And then the second point was peer pressure, and the solution we came up with was educating them physically, educating the young people physically on being content with what they have while working on achieving their goals. And the third point we looked at was poverty, and the strategies that we came up with on how best to